I am 76 years old.
Oh, wow.
And I've never...
Sorry, you look great.
Thank you.
Okay.
Thank you. And I have never had a tooth pulled without being sedated due to the fact, since a child, I've always been afraid of the dentist, which I have gone to dentists before. But I met the nice gentleman, Mr. Ben Levy, and I explained my story to him, and I felt very good with him taking care of me. We used to laugh, which I am an outgoing person, and he really was good at first with me, maybe almost to the end with me, and I felt good with him. So I met him, and he first made these.
The dentures? Okay.
These dentures right here, okay?
Okay.
But they couldn't fit my mouth because they hurt with the hardness.
Right.
So I said, could you, he says, Miss Thornton, I could make you some that made, I guess this is plastic, that didn't hurt my gums, right?
Okay.
So I agree with him. He made the top and the bottom.
Okay.
Well, the bottom never fit. And he says, you need 2 root canal. Me being afraid, and really it went well when he put the root canal in.
Who did the root canal?
Dr. Ben Levy.
You did it.
I did the root canal.
Right. Now, the teeth wasn't fitting right. No, this was before the root canal. So he sent me to a lab. He wouldn't take them back anymore. He made me go to the lab.
Okay, so, well, he made them the first time, they didn't fit. Did you make a second pair?
What we did for her, she wasn't happy with the bottom one. I took away the denture. I sent it to lab. Lab made a new one. She wasn't happy with that one either.
Okay, so there was a second one, and you weren't happy with that one either, and then what?
So what I recommend her said that I understand that you're not happy with this. Why don't you go to the lab yourself, explain whatever you don't like about this denture to the lab, so there shouldn't be any miscommunication. And
who does that? I've never heard of anybody putting the patient in touch directly with the lab. Why would the lab even talk to her?
Your Honor, sometimes in the
Did you let the lab know she was coming?
Yeah.
You did?
Yeah, they'll charge me for that. It's not for free. They charge for that.
They charge you or they charge her?
No, they charge me.
Okay, so she goes, and did you go to the lab?
Yes,
and what did the lab tell you?
Okay, it was a cold night in the snow. I paid $50 to go to Flushing, New York, to this lab. I met the man, and he said just what you said. He said he didn't do too much work for this dentist. He said, but since you came all the way out here, I will help you. So he said, you need to go back and do another impression with the thing.
Right, but see, the impression is the impression, and he sends the impression in, and then they make it based on the impression. Right. Did something change in her bottom teeth?
No.
Were any of the root canals in her bottom teeth?
No, it was just upper.
Okay. All right, well, she said, you ended up having to go to a new dentist, right?
Yes, I just started with him this year. As a matter of fact, I'm still in with him.
Okay.
Yes,
and did you ever get those root canals?
Yeah, let me tell you about the root canal.
Oh, do.
So I said, I'm afraid of these needles, and he was really good. Now, I got these root canals. He did one, then I think, because you had to pay. If you didn't pay, you don't get. So I went, so he did the root canal. We went through that. He says, oh, you did good. I said, thank you. I did my other root canal. Okay, so now I know how it happened because the lab man told me, and he used the old crown. I don't know what you're talking about. And the crown that came out of my mouth. Here's one of them.
Were your root canals? You have a crown in your hand?
Yeah.
Okay, hold on one second. The root canals that you did were on your uppers, right?
Yes, ma'am.
Okay.
Yes, ma'am.
And the crown ends up, the root canals happen when? What month and year?
The root canal was done in 2014.
And when those root canals happen, she already has the dentures?
Yes.
And then, of course, the dentures are going to fit differently when crowns are in there.
Yeah, but we didn't make the crown. Then she came once as emergency.
Oh, did you ever make a crown?
No.
You never made crowns for her?
No. We didn't.
Part of what she's suing you for is a dental crown because she says that one of the crowns you made for her fell out.
No, I didn't make any crown.
Both of them fell out, doctor, because not
Judge, not
judge.
doctor.
Sorry.
But you never made any crowns for her? Can I
No.
see your bills? Was insurance paying or was she a self-pay?
She was paying, but she didn't even pay for the second root canal. She didn't fully pay for that.
Judge.
At some point, you folks break up, like a couple.
Judge, can I say
Tell me
something?
about the breakup, doctor.
Okay, she came to me with her daughter, and she told me
Is
that
this a daughter?
That's my daughter who's
Okay, come on up.
heard me complaining.
She's really
all
sweet
the
lady.
time. And he's nasty.
They came together, and she said that I'm going through this. I'm not happy with my denture, and I said I understand that you're not happy with your denture. What I'm gonna do? I'm gonna give you a refund for whatever you paid for your dentures. You find another dentist. Because I'm working with this lab, I don't have another lab, and you're the only patient that has problem with the dentures. The other patients never had problem with the denture. Okay, so get your money. Go.
Did you refund money?
Yes.
How much money did you refund?
$1,200.
You refunded $1,200?
Yes.
And how much I paid him?
I
Is
gave
that
it to-
accurate?
Yeah, I gave him $1,800.
No, I understand.
Yes,
Did you
ma'am.
get back $1,200?
Yes, ma'am.
Did you
I
ever
just-
sign? What's that? A release?
Yeah. She
Did you
released
not-
and a copy of the check.
And I paid him $1,800 because I still had one tooth left.
Was the daughter
One
present?
root canal. Yes.
Was the daughter present during the release?
No. She was by herself.
yeah, she was there.
You were?
You can't. I don't know. I don't remember.
You know what I'm talking about when we talk about a release?
Yeah,
What do you think a release is?
that you release from the doctor's office.
I released you from this anteroom. No, that's not what a
Right,
release
so
is. What a
tell me.
release is this, which is what you signed, Ms. Thornton, which says, I understand and I agree that I am relying wholly on my own judgment, belief into the nature and extent of any injuries I may have. I release and acquit and forever discharge Dr. Ben Levy and Total Dentistry Care and all other involved persons or entities and their successors, assigns, or administrators, and any and all liabilities arising from any known or unknown personal injury or damage resulting from treatment rendered for the last year. I understand this is a settlement and is a compromise of a dispute, and that payment. In other words, you got $1,200 in order to. Why are you here?
No, I'm here because.
No, you don't get to be here. See, here's the thing. The law encourages humanity to settle their differences outside of court. So that we're not inundated with every single dispute that is out there. So people work it out in what's called a settlement. It's a new contract between the two parties. You give up something, he gives up something. So what you are giving up is, I won't sue you. Fine, you just give me $1,200 and we'll call it a day. The guy gives you the $1,200 and then you run to court and sue him anyway.
No, it's not about.
That is exactly what you
Judge,
did.
What he said to me, he said, "I'm going to give you your money back."
Okay,
because
ma'am,
I'm sick
is this
and
your
tired of
signature?
you." Yes, it is.
Oh, you want to see it?
I know it is my signature.
You're both going. What are you doing? You're inching away little by little, separating yourself from the situation. No, ma'am,
And
you're
you
front
know
and
what,
center. You were there that day when she
Yeah.
signed the release. Did you guys read this?
I'm not.
I read it.
Did you read it?
I read it, but
and you're a
that's-
smart
he
woman,
said
right? Because you
he's
strike me as a smart
very
woman.
intelligent.
And when this says here that you're not going to sue him, why do you run to court and sue him
Because
anyway
I
after you
didn't
get the
say-
throw?
I didn't
Gotcha.
say. But
Right.
no, he told me when the other tooth if it falls out, to come back to him with the $600, the other root canal.
Anybody who writes this is not expecting to see you ever
you know
again.
what? Even if I don't win this case, and and it's that. But he sat there and he lied. But I should have been smart enough. It's not about the money. I'm 76, and if I don't have $1 now, I will never get one. So it's not about that.
You got
but I just don't
$1,200.
He did. No, that's what I gave him. He threw it at me to go to another
No, there's no
dentist.
throwing. There is
He
a
threw it
very
at me.
lengthy release. This is not nobody's shoving anything in anybody's face. This is a release, and my hands are tied. There's absolutely nothing I can do when you sign a release to get those $1,200
And
back.
Your Honor,
this-
I gave her denture. I said that I want you to find another dentist. If you go to a store, you don't like the shoes, you just return it and you go and buy another shoes. I didn't even get her dentures back because I could send it back to lab and get some money.
When
But
you say you gave him $1,800, that covers the 2 root canals too, and you didn't even finish paying for the root canals. We're done,
I'm
folks.
finished.
We're done.
Thank you,
We're
Judge.
done. We're done.
But he know
Good.
what he did wrong.
Okay.
So thank
Good
you
luck
very
to
much.
everybody.
It's a pleasure coming here, and I still look good, and I will
You
finish.
look hot. There is
no.
no other word for how you look. You
I
look
have a
hot.
very good young dentist now that's working very good. Thank you, Judge.